So thank you for joining me for another video. On this recording, we'll have a look of the integumentary system. I anticipate that in the actual face-to-face lecture format, we'll take several sessions to cover this system. So if this video feels like a lot or a long recording, feel free to pause and come back where you've dropped it. I'll probably just go through all of the parts on one go for the purposes of keeping the recordings manageable. So, like we've seen, this week we started by talking a little bit about tissue types, and we focused on the epithelial tissue, which will become particularly useful for us as we now move on to study skin, its functions, structures, color. We'll also talk about the associated structures, such as glands, hairs, nail, and we'll finish off by looking at some of the disease states of the skin. So when we are talking about cutaneous membranes, we are talking about the skin, but that is only one part of the integumentary system. In addition, integumentary system includes all of the associated structures such as hair, nails, and glands, and we'll have a look of sweat and oil glands in a moment's time. When we talk about skin, one of the things that stands out to me is that we see a lot of variation on the skin and types of skin that we see on humans. So whether it comes to the pigments that we're seeing, we also see variation based on the age of an individual and also any damage that the skin has been exposed. Those all do show up on the skin. So yet we have so much variation of the types of skin that we see, yet we all share the same basic structure of the skin. So I think that that's a good way of framing the diversity, yet the shared characteristics of the skin that we see. In a clinical setting, you can actually get a lot of insight of the patient's state of health, their lifestyle, their health condition, simply by looking at their skin. And I think that field of dermatology is often kind of misunderstood or underappreciated when we talk about that. Sometimes I get students who are asking, why would someone go to field of dermatology when you can become a cardiac surgeon or brain surgeon and be the hero of the room? Well, when we have those discussions, I really answer normally that dermatology is such an amazing field because you can really impact the patient's quality of life easily. And not just simply from the medical standpoint when it comes to the clinical condition itself, but also how the patient feels about themselves, how they feel about being part of the society, being part of the larger world. So you can make a huge impact on the quality of life through working in a field of dermatology. So that's what I always remind my students when we talk about these topics. So let's have a look of the integumentary system a little bit and many functions that we see associated with it. So we see that we have the insulation and cushioning of the deeper body organs. That's one, I think I would say fairly obvious function. In addition, integumentary system protects in many ways us. So whether it's protecting us against mechanical bumps or gut cuts or chemical protection, for example, against acids or bases, thermal protection from being in contact with too hot or too cold surfaces, protecting us from UV radiation. So we see that in sunlight, protecting against various different kinds of microbes, such as bacteria. So we'll see that there's some adaptations for that as well. And also protecting us from drying out. So keeping a lot of the fluids inside when they need to be kept inside the body. When we think about other functions, I think one really striking one based on what we've discussed so far on this course has to do with the homeostasis of regulating the body temperature. So whether we need to maintain the body temperature whether we want to lose some heat or we want to preserve the heat in the body. So that's where the integumentary system steps in significantly. And also when it comes to the getting rid of chemicals, so we'll see that integumentary system, some of the examples would be, for example, getting rid of urea or uric acid. In addition to the urinary system or urination, some of those we do also lose through the skin. Final one that I have on this list as an example of many functions, well, with the help of sunlight, we do see that integumentary system plays a key role in vitamin D synthesis. So that requires the exposure to the sunlight. So an important system, I think we end up concluding. And if we look at the skin and the structure of the skin, we end up seeing that we have a few different layers to consider. We have three, or actually to be more precise, two layers of the skin to consider. So epidermis forms the outermost layer of the skin, whereas dermis is kind of an inner fleshy, meaty layer. And this is the layer of what the leather products are typically made of. Then we do have also hypodermis, which is sometimes known as subcutaneous layer, which is not technically skin per se, but attaches to the subsequent layers of the body tissues, the skin. So that's why we also sometimes look at that. And obviously these layers, we see them not only on that schematic diagram that I've provided for you, but if we look at histology, we can clearly see these distinct layers of epidermis, dermis, and hypodermis, for example, very well on this histological sample. So that's something to keep in mind and pay attention when we're studying that. There is a reason why we need to learn about these different layers. So what we're going to be doing next, we're going to go through each of these layers of the skin one by one, but I think it's useful to see their relationship in relation to each other as we do on this picture. So let's start with epidermis. Epidermis is going to be the outermost layer of the skin made of stratified squamous epithelium. So we see many layers of these flattened disc-shaped cells. And when we talk about epidermis, it is worthwhile to remember that it grows from the basal layer. So there's no blood supply after that. So epidermis is a avascular layer. And another thing that we notice with the epidermis is that it is a keratinized structure, keratinized cells. So keratin gives skin its protective properties, and we'll get to explore that a little bit more as we move through the material. So if we look at the epidermis, we can actually separate epidermis into 5 different layers, and these are known as our strata. So the deepest one of those is going to be stratum basale. And notice as on this picture, the layers are moving from the stratum basale, the deepest layer, to the outermost layers, stratum corneum. So the order is that the darkest layer is at the top of the screen and the outermost layer is at the bottom. So don't let that trick you out. As we are paying attention to this microscopic image, another thing that stands out, I think, is how the cells become much flatter and also much more keratinized as we move from deeper layers to the outer layers. Because as we move more and more to the outer level, we see that we need to protect ourselves, for example, from water loss. Eventually, what we see on the outermost layers is that we have just dead cells at the stratum corneum. You can consider these a little bit like shingles forming the outer layer or outermost boundary of the skin. And one thing to notice from this picture that we're seeing here is that the stratum lucidum is found only on thick hairless skin, so it's not represented on this particular sample that I have on the screen. So let's continue exploring epidermis a little bit more. And within epidermis, we will see cells known as melanocytes that produce a pigment, melanin. And this is found at the stratum basale layer of the epidermis. So these melanocytes really give the color to the skin, and this color can vary quite a bit from yellow to brown to all the way to black. And really it depends the amount of this pigment on genetics, but also on individuals' sun exposure. Other things that we will see within the epidermis includes special cells. So, for example, epidermal dendritic cells that alert and activate immune system cells to threats such as bacteria and viruses. And we also see what are known as Merkel cells that are sensory nerve endings, so basically are touch receptors. Let's move on from epidermis to dermis. So dermis is made of strong, flexible connective tissue layer. So it is really what makes the hide that is used to make leather products when we use other animals' skin to produce leather. And this dermis layer contains nerves, blood vessels, lymphatic vessels, and also glands. And there is going to be two distinct layers that we can separate from the dermis. So let's have a look at those. So the first layer that we're going to see is going to be our papillary layer. So papillary layer, as you can see on this picture, follows the indentations of the skin above it. So this would be really, we would see the fingerprints, leaving the impression also on this level. The reason, purpose for papillary layer, really having these folds, having these bends, and skin in general, is to improve the grip that we get of the structures that we grab. Papillary layer also contains pain and touch receptors. Reticular layer instead is the deepest skin proper layer, and this includes our sweat and oil glands and also pressure receptors, so we get the sensations of when we touch the skin. And finally, we get to hypodermis, or our subcutaneous layer, which is, like I mentioned, not proper skin per se. It serves a purpose of anchoring the skin to the underlying structures, organs, and it's mainly made of adipose tissue. So the purpose or function of the hypodermis, if you wish to think about it that way, largely would be things like shock absorption, protecting the underlying structures, and also insulating the deeper tissues, if we want to think of, for example, thermal protection. So now that we've gone through the different layers of the skin, I think this is a good time for us to consider a little bit of factors that may play a role in the skin color. And we've already seen a little bit of this, but let's add to our conversation from earlier. So we already earlier mentioned the melanin, which is produced by melanocytes at the epidermis, giving the yellow, brown, black range of colors that we can see. And we also see that we can have concentrations of melanin when it comes to, for example, freckles. Some vegetables such as carrot, food, if you consume that a lot in the diet, that might contribute also giving you more of an orange color for the skin. And then let's discuss about hemoglobin. Hemoglobin is found within the red blood cells, and hemoglobin responds to the oxygen concentration. So if we have high oxygen concentration in hemoglobin subunits, that blood is going to appear very bright red, and low oxygen concentration then as kind of a darker purplish, bluish color. So you can see a lot of the blood through the skin, and this is really what gives the reddish undertone of the skin color. But we can also tell whether the patient's blood in these vessels is well oxygenated or poorly oxygenated. So sometimes in clinical setting, we might look for those signs and symptoms. And finally, I'm mentioning their albinism, the lack of skin pigment, which will then give the characteristic appearance of those individuals who are albinos. And we can also tell a lot about individuals' health by looking at their skin. So I've listed on this slide a few different alterations of skin color as they indicate diseases. So I'll let you investigate those further if you're interested on those, but there's a kind of a broad range of what we can see there. And we do have other things to consider when we talk about the skin structure as well. So we see our sensory receptors that play important role in sensations, immune system through adaptations for eating away pathogens or old cells or old particles of the skin. We see collagen and elastin, which really give the skin its recoil abilities. And then, of course, the blood and lymphatic vessels that supply nutrients, oxygen, and remove waste products from these skin tissues. So I think that brings us to move our focus to talk a little bit about cutaneous glands. So these are glands that we find within the skin, and all of these glands are going to be exocrine glands that we're going to look at. So let's have a look of two types. First, I want to start with sebaceous glands. These are our oil glands. So these secrete sebum, which is our oil, and they have ducts that open to the hair root or to the skin surfaces. And the purpose of this oil production, really, if you think about it, is that without some oil on the surface, the skin and as well hair would become very dry and very brittle. And in addition, we see that these oily secretions protect us against various different kinds of pathogens. So they form kind of a chemical layer of protection in addition to the mechanical protective layer of the skin. We find these sebaceous glands in all parts of the body except palms and soles, and they become particularly active after we go to the puberty. So next type that I wanted to mention is going to be our certiferous glands, so our sweat glands. And these are widely distributed in the skin and produce the sweat. And there's really two types that we're going to see. So first, we're going to have excretion glands, and these open via ducts to the sweat pores of the skin surfaces and produce acidic sweat that includes things like water, salts, vitamin C, and traces of metabolic wastes. And their function really has to do with the body temperature regulation. And then we're going to see apocrine glands, and these have ducts that empty into the hair follicles in the armpit and genitals. So they begin to function at the puberty, and the sweat that's released also contains fatty acids and proteins, making it kind of a milky and yellowish in color in comparison. They have very minimal role in body temperature regulation. Now let's move on to these kind of accessory structures of the integumentary system, and let's start by having a look of hair. And here we have different parts of the hair. So hair grows from the hair follicle, and within there we will find the hair root. And the part that's above the skin of the hair, that's known as the shaft of the hair. So here is keratinized epithelial cells, so dead material, just as our nails. And this keratinization really gives the hardness of the hair, but also hardness of the skin cells. And when we talk about the hair color, it is melanocytes that produce pigment. So that gives the hair their color. So we can do that comparison to what we saw with the skin. And melanocytes there play an important role with the skin color. And again, remember albinos, for example, would not produce any pigment. So we would see that they would have white hair. Let's have also mention of the hair bulb. So this is where the cells divide for the hair to grow, and found in the innermost layer of the epidermis known as stratum basale. And you can see a particularly good microscopic image of this hair bulb on this slide. So let's keep going onwards and have a look at a couple of other structures that I want to highlight. In relation to the hair, I do want to mention erector pili muscle. And what erector pili does, it's responsible for raising the hair, so we get goosebumps. And the purpose of goosebumps, the hair standing up, is kind of sometimes a slightly debated but very varied concept. So these hairs play an important role in thermoregulation, also in kind of creating trying to intimidate an enemy, so making an individual look bigger. If we talk about animal world, when hair on a cat stands up, that's what they're trying to communicate, that I'm a scary target, you do not want to attack me. And we also see, especially on humans, that the goosebumps have an interesting role in emotional involuntary responses to certain stimuli. So for example, for an experience of fear. So this is where we can start thinking about those kind of evolutionary connections to our animal peers. And let's have a look of nails next. So nails are very heavily keratinized, scale-like modifications of the epidermis. And the stratum basale extends beneath the nail bed, which is responsible for the growth of the nail. And we also see that nails lack pigment, which makes the nails colorless. And if we think of the function of the nails, I would propose that there's few ways of approaching this. Obviously, nails play an important role in our fine grip, but they also protect the ends of the fingers and toes. We tend to bump our toes and fingers, especially if you're a little clumsier like me, every now and then. And these nails protect that we don't get a significant tissue damage when that happens. So now that we've covered the key parts of the integumentary system, I think it's a good time for us to have a look of some of the disease states of the skin. And there are many diseases, and I do want to discuss again briefly the fact that skin diseases, not only they are a medical issue that we want to address and treat, skin issues can have a significant impact on the psychological well-being and social relationships of an individual. So if we're able to address those, if we're able to treat those skin disorders, we can really do significant benefit to the patient's well-being. So let's review some examples of skin diseases. And as we go through this is the time where I'm going to give heads up that if you're a very sensitive person, I do have few graphic images coming up on the next slide. So if you feel easily uncomfortable with graphical examples of skin disorders, it might be time for you to skip this part. I'll put a timestamp on the notes of this recording, or you can just simply listen for the next section. So 3 examples of skin disorders that I have here. Let's go through those. Athlete's foot is caused by fungal infection, resulting in itchy, red, peeling skin between the toes. When we talk about boils, we're talking about condition caused by inflammation of the hair follicles, resulting in clusters of boils caused by bacteria. Cold sores, and that's what I have the first picture on the top on those series of pictures, are also known as our fever blisters, and they are caused by human herpes virus 1. These are blisters that really itch and sting. When we talk about contact dermatitis, we're talking about that being caused by exposure to chemicals that provoke allergic responses. In response, itchiness, redness, and swelling of the skin are some very characteristic signs and symptoms. The next picture, the picture in the middle that I have on this series, is going to be an example of impetigo, which is caused by bacterial infection, resulting in pink fluid-filled raised lesions around the mouth and nose region. And temp psoriasis, and that's the last picture that I have done this series at the bottom, is triggered by multiple factors that can act together or separately. These factors include, for example, trauma, infection, hormonal changes, and also stress. So really multi-causal history there, resulting in red epidermal lesions that are covered with dry silvery scales that itch and burn and sometimes might even bleed. So bunch of conditions there to consider. Varying severity is possible for each of these. And again, I often think not just the medical role of these conditions, but how they impact the patient's quality of life, social relationships, self-confidence, and things like that. Let's move on and talk a little bit about burns. And when we're talking about the burns of the skin and body, we're talking about tissue damage and cell death. And there's many causes that can cause burns in our body, whether it's a heat burn, electrical caused burn, or caused by UV radiation, or even chemical burn. So we see that these are a varied group of tissue damage and cell death. Two of the biggest dangers or challenges that we see when we talk about burns have to do with once we lose that protective barrier that the skin normally forms. We have typically on patients, if the burns are larger, a danger with a loss of body fluids because we're no longer keeping the body fluids inside thanks to the skin. So now that the skin is missing, we might have issues with that, but also the skin's protective role in protecting us against infections. So this higher risk of infections on people with burns results from the invasion of bacteria that might take place as we lose this layer. So let's talk a little bit about the extent of the burns, and that's quite often important in clinical setting to estimate how large of a portion of the body has been burned, and we use something known as rule of nines to estimate the extent of burn. And how this works is that body is divided into 11 separate areas that allow us for a quick estimation of the extent of the burn, and each area represents 9% of the total body surface area. Exception to this is the area around genitalia, which represents 1% of the body's total surface area. So that's how we can estimate the extent of the burn. And let's talk a little bit about different severities of the burns. And burns are really classified by how deep within the body or deep within the tissues they go. And again, at this point, I'm going to share a warning that I have some graphic pictures as examples of various degrees of burn, so we can appreciate the differences between those. So if you're squeamish, again, I will put a timestamp at the end of the notes of the video, but you can also just look away as we review these 4 different degrees of burn together. So let's start by talking about first-degree burns. These are only superficial burns, and we see that only the epidermis is damaged in these. As a result, the skin appears red and swollen. Second-degree burns instead are known as a partial thickness burns. So this is where epidermis and the superficial part of the dermis are damaged. And as a result, we're now seeing that the skin is again red and painful. But importantly, on second-degree burns, it's that we're going to start to see blisters forming. On second-degree burns, the regrowth of the epithelium is still possible, so the prognosis, as long as other things don't happen with the fluid loss, bacteria, viruses getting in, we do have a fairly decent prognosis. Once we get to the third-degree burns, these are our first group of full-thickness burns. This is where epidermis and dermis are completely destroyed, and the regeneration of the tissue is no longer possible, so skin grafts are going to be needed to treat these kinds of burns. The burned areas on third-degree burns appear kind of grayish, whitish, or even black. And finally, our fourth-degree burns. These are the second more severe type of the full-thickness burns, where we see that they extend all the way into the deep tissues, such as bones, muscles, or tendons. And the appearance of these burns is really kind of a dry and leathery. These ones definitely do require surgery and grafting, and often may lead to amputations as well. So the question is then that when a burn is critical and when we have any of the following 5 conditions taking place, we say that that type of burn is critical. So first, if the burn covers 30% of the body being covered with second-degree burns, that would be considered as a critical burn. If we have 10% of the body covered with third or fourth degree burns, that also makes that burn critical. If we have third or fourth degree burns in face, hands, feet, or genitals, that would also make that kind of a burn critical. Obviously, if burns impact one's airways, that would be a critical setting for us because we always want to secure the airway. And finally, if the burns end up extending around the body completely, that would make those burns critical. So any of those 5 criteria would make those burns critical for us. So let's finish off our discussion of the integumentary system by having a look of a little bit of skin cancers before we talk about age-related changes. So the skin cancers represent the most common cancer type that we see in the humans, and its main risk factor really originates from the overexposure to UV radiation. So this is where being overly exposed to sunlight or being overly exposed, I think in 90s, early 2000s, tanning beds were very popular. Those would increase one's risk of skin cancers. And again, I do have a few pictures. I don't think they're too gruesome, but if you feel uncomfortable, feel free to look away when we talk about different skin cancers, skin changes. When we talk about cancers, I think what's important for us to note there is that we classify cancers into 2 types. Benign cancers are when the tumor has not spread, so it's a localized tissue growth, and malignant cancers are cancers where the tumor and the tumor's growth has spread to other body areas. And obviously benign tumors, they are a little easier for us to treat. We can focus on that location. Whereas when the tumor, when the cancerous tissue starts to spread around the body, that's when we face significantly more challenges in terms of managing the patient's clinical care. So let's talk a little bit about the fact that it is so important for that reason for us to monitor any changes in our skin. The first picture that I've provided there on the left-hand side shows an example of basal cell carcinoma. This is the least malignant type and most common type of skin cancers that we see. Here, the cells in stratum basale are altered and as a result can no longer make keratin. So we end up seeing these lesions that are shiny and have kind of a dome-shaped nodule, and they might eventually develop a central ulcer as well. The second picture on this series of pictures that you see, second from the left, is going to be an example of squamous cell carcinoma. This is caused by or induced by UV exposure and arises from the stratum spinosum. The lesions of this look like kind of scaly reddened papules, gradually forming into shallow ulcers. Early removal of these squamous cell carcinoma lesions results in good chances of a cure, but if left untreated and not removed, there is a high risk of them spreading to the lymph nodes. So that's why, again, we do want to get those skin changes noted and checked by professionals. Finally, I'll just mention the malignant melanoma. This is the most deadly skin cancer that we have, about 5% of all of the skin cancers, and this originates from melanocytes. It is very quick to spread to the lymph and blood vessels, so that's why really catching it, aggressive treatment is necessary. And when we talk about skin cancers, we have for their detection of melanomas something that we call ABCDE rule. So what we do when we look at the melanomas, we focus on 5 different factors. First, we focus on asymmetry. So we're looking at, are the 2 sides of the pigmented mole matching or are they not matching? And if they don't match, that would be a concern factor. We also look for border irregularity. If the borders of the mole are not smooth, that's another indication that makes us concerned. We look at the color. So if we see different colors in the pigmented area, that's more of a concern than a uniform colored appearance. We also look at the diameter of the mole. If the spot is larger than 6 millimeters in diameter, then that gives us a cause for concern. And final factor is that we look for evolution. So if any of these, any or even more of these than one changes or characters are changing, evolving, that is another concern for us as we tackle these potential detection characteristics of melanoma. And let's finish off our lecture together by having a look of the lifetime changes in the integumentary system. So over lifetime, we see some changes, especially in the younger individuals. Skin tends to be thicker, more resilient, and well hydrated. As when you get older, skin does lose its elasticity and becomes thinner. So that's why you can see all the blood vessels much more clearly in older patient populations. And also we get kind of the sagging of the skin, especially if there's significant weight loss that will show up also the elasticity much more as loose skin. In other terms of the other parts of the integumentary system, we see in older individuals loss of hair, so baldness coming, and also the changes of color, graying of the hair as well. And that brings us to the end of what I wanted to mention about the chapter 4, our integumentary system. I know it was a lot of information, so in a classroom we'll cover this material over several lectures together. These recordings are a little bit more condensed, but hopefully it's helpful to have this resource available for you. Thank you for joining me, and I look forward to seeing you at the next video. Until then, bye.